Sir, and then I'll come back over here.
So, Congressman, what can you tell us about the provisions of the Class Act, which are in the health reform legislation, concerning long-term care? Who's eligible, what's covered, premiums, and benefits?
So the question was about the Class Act, which is a long-term care insurance program that is created by this reform. And I'll say two things about it, and one is a comment that will apply to the overall reform. One is you will, at your election, be permitted to essentially buy long-term care insurance through the Class Act. And you will be able to take advantage of the fact that many other Americans will be purchasing as a unit, and therefore you can get cheaper pricing, just the way a corporation gets cheaper pricing with its 20,000 employees or whatever, for long-term care. It's not mandatory, it's an option for people. But it is something that bears watching because it's a new thing. The government has some experience in providing health care through Medicare and TRICARE and the VA, but the new long-term care insurance option is one that we need to monitor such that it doesn't become a drain on the Treasury, that the premiums end up paying for the benefits that come out the other end. Yes, sir.
Thank you. I met with you a couple of weeks ago, do you remember?
Yes.
Yeah. And it was nice of you to get back to me with this letter, but the 7 letters that I gave you from different individuals, it wasn't addressed. I know you can't talk to everyone, but it wasn't even hinted here. I'm glad that you brought up the death penalty in the very first thing, because you're right, it doesn't exist in this bill. Are you familiar with the Federal Coordinating Council for Comparative Effectiveness Research, the CER?
Yes.
Okay. Can you tell me what that does? Because it's actually in the stimulus bill?
Yes.
Okay.
Yes. The question was about comparative effectiveness research.
Yes.
The stimulus, the American Recovery and Reinvestment Act, put billions of dollars into comparative effectiveness research. That research is designed to do one thing, which is to have the government, which is not a pharma company or a health insurance company, which may have a stake in the answer, fund research to determine what treatments and procedures are effective and which are not. If you talk to doctors right now, it's sort of interesting. There's lots of studies run by lots of different kinds of people out there, but for most maladies, there's not a lot of objectively available evidence on what works and what does not. That costs us an immense amount of money, because oftentimes a doctor facing some uncertainty will, instead of choosing the one that objectively is shown to be effective, will say, let's try 3 different things. I'm not sure which will work, but one will work. This will be a very good investment in providing doctors with a lot more scientific data than they otherwise have that will allow them to say, let's do this because we've got data that shows that it's effective.
Well, now there's one little part of it this was all put into law, and this affects the health care reform, right?
What you're talking about now is the Recovery Act. Yeah.
The coordinator entity, it's called the National Coordinator of Health Information Technology. By the way, this is Section 804 of the stimulus bill. The coordinator entity will have the electronic medical records readily available for them to review, and in fact, in the stimulus bill, is following this quote. It says that this coordinator, quote unquote, will guide medical decisions at the time and place of care. That means that it's not the doctors determining, it's the coordinator. Who the heck is the coordinator? Where do we get a hold of him? One other thing, and now sit down. Your SGR 21% doctor fix is expiring in 2 days.
So the House has fixed the SGR, and I think the Senate will act. I will say what I said before, which is there is no way on God's green earth that doctors are going to face a 21% reduction on Medicare.
I'm disappointed.
That's fine. You have every right to be disappointed. But what I will tell you is that there is no way that doctors are facing a 21%.
They could have done it a month ago.
Okay, we should have done a lot of things a month ago. But
yes.
Anyway, let me address this. I don't know what it is you're reading there, but there is nothing in this bill.
Section 804.
There is nothing in this bill that will intersect comparative effectiveness research with the time and place of the delivery of service. No, I'd have to look at what you're reading.
Please.
No, he's disagreeing. He said it's not.
Let him disagree first. Be quiet. You had your time.
Okay. We're off of, and very soon we'll move to a broader discussion. But I will also offer this.
You didn't answer what he wanted you to answer.
There is nothing in this bill that will allow any government entity to compel or forbid care that doctors determine that you are eligible for. There is nothing in this bill that will do that. And in fact, I would go on to say that in the Medicare system, a commission was established by this bill that will be subject to the same kind of political discussion that we heard over this. This commission was established to try to come up with recommendations on how to deal with the financial unsustainability of Medicare. Now, we all say that's a good thing, because Medicare has some very serious financial issues, but we all worry about it because could this commission come in and say, we're not going to cover X, Y, and Z, and how would I feel about that? Would my doctor agree? For better or for worse, and depending whether you're sort of out here on the fiscal responsibility side or out here on defend every last, patient's every last treatment, you'll think it's better or worse, but the Medicare Commission has no power to impose changes on the Medicare system. They only have power to propose changes to the Congress of the United States. So even with respect to a problem as severe as the developing unfunded liability in Medicare, this Commission does not have the right to force changes. They have to ask Congress to make them. Let me ask this, we're getting questions off topic. Are there any remaining questions specific, and if the answer is no, we'll move on to a broader discussion, but are there any remaining specific questions about how seniors are affected? Let me take those first. Really, about how seniors are affected, and then we'll move on to a broader discussion. Yes, ma'am.
Yes. I'm an economist, and I look at numbers. When you are adding 31 million people to the healthcare system, and you have 46% of primary care doctors that are saying they're going to leave the field, you have Walgreens in Washington State that started the trend by saying they're not going to accept Medicare, new Medicare patients. How is it, looking at these numbers, that you can say that seniors can expect to spend more time with their doctors when you're going to have more patients, less doctors, and less new doctors that are starting medical school because they don't see that as a lucrative career as they did once before?
So